Hey guys, Tourette here. So, in the article that we're going over for anxiety and Tourette's, this is part 3. The new findings prove useful to neurologists who often treat TS patients, but may not be aware of the full spectrum of possible psychiatric comorbidities. Seeing a disorder said that the senior author, Jeremiah Schraff, MD and PhD of the MGH Psychiatric of Neurodevelopment Genetics Unit, also known as PNGU, an assistant professor at the Neurology of Harvard Medical School. The origin of the TS is in part of the brain that is overlap between neurology and psychiatry, and said Schraff, and knowing that the range of diagnostic possibilities in forming collaborative teams with psychiatrists is important to successfully treat TS. So, some of the things that I've personally have been offered, obviously is medication, to help with some of the neurological deficiencies that people with Tourette's have. So it's something in their brain chemically that basically triggers them to have to make these tics. But in part of it, obviously being that it's part of the brain, there is some psychological matter to it as well. Obviously, a lot of things are stress-induced, cause of anxieties, that also will push your tics out. So, in order to help with your tics, a lot of times most doctors will actually offer a mixture of both medication and therapy by talking to psychiatrists or talking to a therapist to help treat the Tourette's. I know with me, some of the things that they try to help with Tourette's is actually going through different breathing measures to help with different stress levels that will help also bring down the tics, because obviously if you're helping your stress is what induces the tics. Ultimately, it's going to help with the reduction of your tics. So, the good thing about, this is that it's not just talking about how both Tourette's and, anxiety exist together, but how there's multifaceted ways in how we can help fix these. Comorbidities are something that is fairly common through majority of all TS patients, and there's more than one way in order to treat it. So, here's for today to help educate you on not only about Tourette's and anxiety, but also what you can do to help with mitigating some of the side effects of Tourette syndrome by using different ways of how to help reduce those things by going through different treatments that can help successfully reduce your tics. And then, as always, thank you for following. Hit the like, hit the follow, leave a comment, and as always, thank you for coming to my TikTok. I appreciate y'all.